非常感谢杨海东先生真诚的那个谈话。接下来我们有请我们来自美国的科尔教授及他的翻译来为我们分享一下什么是年轻。谢谢大家，掌声有请。OK， 需要椅子吗？不用。来，这里。
Thank you for allowing me to be here. Thank you to my host and hostess for allowing me to be here. It's a pleasure. I'm looking very forward to sharing with you all my knowledge about hormone replacement and aging and what you can do to stay young and healthy.
大家好，我是杨晶，今天我是科尔医生的翻译。科尔医生他已经有超过30年的行医经验，在抗衰老领域内也有将近20年的经验。今天我们要给大家带来的讲座的题目，一是从就是整体的角度来给大家介绍一下衰老的原因，还有衰老进程。第二个讲座是关于内分泌和抗衰老之间的应用。谢谢大家。
So China, just like all of the countries in the world, are having an increase in the number of people getting older. Our aging population is increasing. And with that comes a number of medical problems that need to be addressed. So the incidence of high blood pressure, heart disease, diabetes, obesity, Alzheimer's disease are on the increase. And this becomes a big problem for many nations.
就是我们中国现在因为经济发展，所以人们的生活品质都变得越来越好。比方说，我们的饮食也会有更多的就是高热量、高脂肪。然后，因为平时休息的时间很多，同时呢，人们体育锻炼也减少，所以就引发了一些慢性疾病的发生，比方说高血压、糖尿病、呼吸系统的慢性疾病、癌症等等。
Osteoporosis is a major concern in China. It's probably one of the most serious problems. The incidence of osteoporosis affects over 7 million people in China. And those numbers are going up. And so by 2020, they're anticipating 286 million people will be affected by osteoporosis.
目前来讲，对我们中国来说，骨科疾病是一个影响很大的疾病。目前来说，我们中国已经有超过7000万的患者有骨科疾病，比方说骨质疏松等。然后根据美国的调查，如果按照这个比例继续生长的话，到2020年，我们国家会有2亿8千万的患者。
Now, anti-aging medicine is a new medical specialty. It began in 1993. I've been involved with it since 1994. And really the purpose of anti-aging medicine is not to just live longer as an older person, but to slow down and reverse the symptoms and diseases of aging where possible.
抗衰老医学在美国是从1993年开始的，而科尔医生他在1994年加入抗衰老这个领域。从他的理念来说，抗衰老并不是让已经年老的人活得更久更长，而是让我们在活着的时候可以更好的享受生活，而且可以缓慢或者停止衰老的发生。
So traditional medicine treats the outcomes of aging, but anti-aging medicine changes the process of aging.
传统的医学是对由衰老产生的疾病进行治疗，而抗衰老医学是在预防我们会因为衰老而产生的疾病。
So as an anti-aging doctor, I have many modalities that I can use, many things that I will look at to assess your health function. We want to look at your current health status. We want to look at your heart status, your brain status, your bone health. There's a number of things that we can do to get an idea of how you are aging and to help put together a program designed just for you.
在抗衰老领域中，我们要研究的方面有很多，比方说，对于一个客人，我们需要了解的就是，比方说他的大脑健康、骨骼健康、内分泌健康、情绪健康，还有比方说他的身体素质、基因风险、他的营养学的需求等等。
So the goal of anti-aging medicine is not just to treat a disease, but to create a program to keep you healthy as you grow older.
一个好的抗衰老的治疗，并不是让您远离疾病，并不是给您治疗疾病，而是让您在变老的过程中也能一直保持健康。
So we have available to us now the ability to do advanced cardiovascular testing. The idea is to pick up a patient who may be at risk. Now at Rejuva Medical Spa, they have the ability to do some of these advanced blood tests. So when we look at cholesterol, we're not just looking at the basics of cholesterol, but we can break it down to particle size. We can look at a particle called Lp(a) that's puts you at a very high risk of heart disease. And we can get an idea of what your problems are and how to best treat this. So advanced lipid testing is available to you now.
我们在锐健做的抗衰老治疗中的心血管血液检测中，不仅仅包括像我们平时在医院里能查到的胆固醇，我们还有一些其他的检测，能更好的判断您的疾病的几率。
There is a marker that can be looked at called C-reactive protein, and that looks at inflammation. So we know heart disease is an inflammatory disease, and we can design a program specifically to begin to decrease inflammation.
比方说，我们有一个 CRP 这个检验，这个是能检验您身体中的感染的一个指数，而这个指数能很好的判断您有没有可能会有心脏病啊、癌症等等。
In my practice, we start with the diet. So if there is evidence of inflammation, we look at your diet and we try to take away those foods that may be causing an increase in inflammation or at least continuing that inflammatory process. So it always starts with basic things like looking at your diet and lifestyle.
因为感染就是像我们上一个幻灯片提到的，感染会引起我们身体中很多疾病。这个是科尔医生他在他的行医中经常使用的。如果我们想抗感染的话，有些食物是对我们比较好的，有些食物是我们该避免的。
Insulin is another blood test that can be done at Rejuva. Insulin is a hormone that's released by your pancreas in response to a diet high in sugar. Insulin has many problems associated with it. It's one of the few hormones that go up as you get older. And with high levels of insulin come all kinds of problems, including heart disease, diabetes, obesity. And these are things that can be looked at and treated adequately so you can improve your insulin levels with simple things like diet and exercise and stress management and, if necessary, medication.
胰岛素是一种荷尔蒙，它是由脑垂体分泌的。这个胰岛素如果高的话，它会影响我们血糖的高低。然后如果长期下来胰岛素都是高的话，它会带来像心脏病、 糖尿病，还有一些比方说癌症之类的风险。如果一个客人的胰岛素高的话，我们可以通过合理的膳食调节、运动调节、压力管理或者一些药物来帮助。
We use a glycemic index of foods when we give our patients this. The glycemic index is the tendency of a food to quickly turn into sugar. Everything compares to sugar, and the sugar level will raise the insulin levels. So in my patients, we're always going to recommend a low glycemic diet, and we help you create that.
科尔医生现在提到的是有他在行医中他用到一个也是一个表格，然后上面说明了每一种食物它的这个有的食物它会它的糖分就比较容易转化到身体里，然后造成您的血糖高，因为在
Vitamin D is a very important hormone, really, to measure. We measure it in all of our patients. Low vitamin D is associated with heart disease and stroke, diabetes, depression, osteoporosis, cancers. So vitamin D is a very important one to measure, and it's epidemic now, the number of countries with vitamin D deficiency.
维他命 D 是一个非常重要的检测，因为低的维他命 D 会导致会增加像心脏病、中风、糖尿病、高血压的几率。然后维他命 D 呢，它在很多国家都是人群都是很低的，因为比方说光照不足或者就是食物中摄取维他命 D 都会造成您的维他命的指数比较低。
This is just a chart showing how prevalent vitamin D deficiency is throughout the world. You can see where China is, but this chart is really looking at very, very low levels. And so all those numbers will move to the right if you look at suboptimal vitamin D levels. So in my practice, we want vitamin D levels to be around 60 to 70 for an optimal level.
这个是一个表格，我们能看到中国现在有超过45%的人是严重缺乏维他命 D 的。
Other risk factors that we can look at in the blood and that are being looked at Rejuva is there's a blood test called homocysteine. And homocysteine goes high if somebody is B vitamin deficient, B12, folic acid, B6. It's very inflammatory. It's associated with heart disease and stroke. It's also associated with cancers. We can measure it. You can change it with diet. You can change it with vitamin replacement.
我们现在说的是一种氨基酸，这种氨基酸会因为您身体中的维他命 D 缺失而变高。然后，如果这个氨基酸它的指数比较高的话，可能血液的血管壁就会有一些损伤，还会增加您的心脏病和中风的几率。
At Rejuva, they're going to be offering stress tests, which is great to assess your cardiovascular risk. It's great if you're about to start an exercise program. It will create a safe program for you. They will be offering something called Vo2 Max, which correlates with your aerobic conditioning. And it's very, very good for helping you to pick the right program for you. And it correlates very nicely even with brain health.
现在说的是一个运动心电图的检测。运动心电图就是病人会在跑步机上，然后我们用 EKG 来测量您的运动心电图。这个检测它会帮助您判断适合您的就是体育运动的范围。然后我们另外还有一种呼吸检测是和运动心电图检测一起进行的。
So this is called Vo2 Max, and it's basically the maximum amount of exercise that you can utilize during maximum intense exercise. It's measured as milliliters of oxygen per kilogram, so your weight really affects this Vo2 Max. So as we get older and we gain weight or our lean body mass goes down, so does this. So Vo2 Max goes down with aging, it goes down with loss of muscle, and we can measure this very nicely.
Vo2 检测是一个检测您运动时候的新陈代谢率，它会检测您在运动时候的氧气利用率，这个也是在美国一个运动医学上非常流行的检测。比方说衰老或者一些其他的疾病会引起您的 VO2 的指数降低。
So this is a chart. You can see where it levels off. That's as much oxygen as you can get from an aerobic activity. After that point, even if you increase intensity, you can't use the oxygen. And so this is genetically determined. Some people will be better than others, but there's a number of things you can do to improve your fitness level.
这个表格是说，像大家能看到 VO2 那个点，就是如果您的 VO2 只能到达那个点，您之后即便再加强您的运动强度，您的氧气利用率也是会停留在那个位置。但 VO2 这个指数通常是有遗传的因素，你也可以通过运动还有一些合理的膳食来调整，来增加您的这个指数。
So a number of factors, like we said, can affect this. Genetics, certainly. It goes down with aging. It goes down with change in body mass. And there are a number of hormones we can use to help your Vo2 max. Specifically, growth hormone is shown to be very beneficial at helping you achieve your best level of exercise.
VO2 它会VO2 在运动中是一个非常重要的检测。人们就像我刚刚说的，人们在变老的时候，这个 VO2 也会随之下降。还有，如果您的身体的脂肪增多、肌肉减少的话 ，VO2 的指数也会下降。科尔医生刚刚还强调了，在荷尔蒙治疗中，比方说生长荷尔蒙会帮助您的 VO2 的指数增加。
This test is called, it's an ultrasound test that looks at your carotid artery. It's very specialized. It will be offered. And they're taking a measurement of one little layer in your artery. It can pick up heart disease before you have any symptoms. It can pick up heart disease even if your lipid panel is normal. So it helps identify someone who might have a risk. It also is very good at predicting cognitive function. So this is a wonderful test to do early on in people, and it's a very nice test to follow because you can make sure things aren't progressing.
现在说的是一个颈动脉超声波的检测，这个检测它是在您的颈部，然后用超声波来看到您的血管。这个检测它可以在您的血液检测没有指出您会有心脏就是一些心血管疾病之前，发现您的心脏病或者中风的几率。
And the other important thing about this is it helps to pick out a patient that needs to be treated. So sometimes you can have a high cholesterol level, but it's not doing anything bad for you. And if your carotid artery score is normal, maybe we don't have to treat it, we just keep an eye on it. On the other hand, you could have a normal lipid panel, but a lot of inflammation, and you might be someone that needs to be looked at.
这个检测还有一个好处就是，像比方说您的胆固醇指数高，我们通过这个检测可以知道您需不需要被治疗。也有的人他可能在血液检测中没有任何表明说他会有心血管的疾病，但是他的血管会告诉我们他需要这方面的治疗。
So what about brain function with aging? So there's a number of changes that occur. There's a number of cognitive functions that decrease with aging. Your mental speed, your reaction time, your ability to switch from one activity to another, all of these drop with aging. Attention and memory maybe or maybe not change with aging, but sometimes they can be a drastic change after the age of 50.
我们现在说的是大脑的健康。通常人们在40岁之后，我们的处理问题的速度、反应能力，还有认知能力都会都会逐年下降。而像注意力和记忆力这种问题，要么就是在50岁的时候突然下降，要么您就可以一直保持一个比较好的状态到80岁。
Sometimes there's an accelerated change in aging. This is a picture of what happens to the brain with Alzheimer's disease, and you can see it just shrinks away. And these are things that can be followed over time.
您看，左边的图，那个图的左侧是健康的大脑，而右侧是得了老年痴呆症的人的脑部。就是随着人们的年龄增长，大脑会有因为它会丢失脑细胞，所以大脑会逐渐萎缩。
So people come into my practice and they're always worried, am I getting Alzheimer's? What's happening to my brain? I can't remember things. And so this is a little questionnaire that we use, and you can ask yourself the following questions. So, do I lose things often?
这是一个对于就是随着我们的年龄增加，我们的大脑也会随之衰老。这是一些调查问卷来告诉您是否需要大脑治疗的项目。它的问题第一个是您会不会经常丢掉东西或者忘记。I can do it. No. 然后像第二个就是比方说您会不会在停车场里找不到自己的车，然后呢比较难记起来一个电话号码，你必须要写一个在纸上写您需要做的事来帮助您记忆，或者您可能以前认识的一个明星，您突然忘了他的名字了。还有您觉得记起20年前发生的事比记起2天前发生的事更容易。数学在算术上方面有问题，还有觉得比较难学新的东西等等。
Okay, so if you answered more than 3, we want to help create a program to make your brain better.
如果您有超过3项都是回答是的话，您可能需要再做一个更详细的检查。
So there are a number of factors that can affect your memory. It can be as simple as a B vitamin deficiency. It could be you don't have enough fatty acids. Certainly vitamin D is important. Hormones are really important here. Women that enter into menopause don't know what happens to their brain function. It just sort of goes away, and we can really improve that.
有很多方面都会造成我们的记忆力下降。维他命 B 是一个很重要的方面，维他命 D 也是一个重要的方面，还有一些像脂肪酸、氨基酸的缺失，还有荷尔蒙的失调也会造成您的记忆力衰退。
So one of the best things you can do for your brain is keep your heart healthy. So a healthy heart is a healthy brain.
让您的大脑保持健康的方式就是您要有一个强壮的心脏，您的心脏越健康，您的大脑也会越健康。
Mercury is very neurotoxic. It's in a number of fish, and they're usually fish. We'll look at a slide that have big mouths. But mercury, when levels are high, can very much affect your memory. And so these are things that can be measured at the spa, and we can help design a program that helps you clear out that mercury.
我们现在说到的是一种重金属，它是汞。这种重金属会比较强的影响您的记忆力。然后在瑞健，我们有做重金属的各种检测。
So this is showing that the people who have the highest mercury level have the poorest brain function.
这个图就说明了我们就是看最右侧，这个就是身体中汞的含量比较多的，它的大脑的功能就会和其他的相比更低一些。
Again, greater than 4 servings a month of fish that have large mouths, like shark, tuna, bass, swordfish, can be associated with elevated mercury levels.
现在说的是有一些鱼，比方说吞拿鱼、鲨鱼等等这种嘴比较大的鱼，它会，如果您长期食用的话，会造成您的汞的指数更高。
So you can definitely measure your level, and then we can help design a program that helps you get rid of that mercury. In my practice, sometimes we'll have patients that like to eat sushi, and they come in with very high levels, and they may want to continue to eat their sushi. And so what we have them do is maybe once a quarter or twice a year, do a detoxification program. So at least we can help them manage that.
刚刚医生提到，在他的行医经验中，他有一些病人是很喜欢吃寿司的，因为寿司中有很多生鱼的成分。然后这些病人呢，就会通常有比较高的汞的指数。像这些病人，我们用的治疗是每年要2到4次做排毒的治疗。
So we want to protect your brain. Again, exercise is great, healthy heart, great. But the other thing that's really important for a healthy brain is to replace those key hormones.
我们能帮助自己大脑功能的方法有很多，比方说，吃足够的维他命和营养物，多运动，还有像静坐冥想。最重要的就是把您身体中所缺的荷尔蒙或者不平衡的荷尔蒙帮它平衡了。
So there's many vitamins that you can use to help protect your brain, such as fatty acids, and there's a number of them. This is a big long list. There's products that are going to be carried at the medical spa, and they can help you create a program based on your assessment and what you need. So there's many things. Melatonin is great, vitamin D is great, B vitamins are great, ginseng is wonderful. So we can help you be in a program that makes your brain sharp and makes you much happier.
现在说的是一些对大脑健康有帮助的营养物，其中包括像欧米伽3、维他命 B、维他命 D 等。在我们瑞健，我们有一个营养的检测，可以告知您身体中所缺的营养，然后来帮助您进行治疗。
And this is just a slide that shows how the more exercise you do, the better cognitive function.
这个图说的是，像我们看最右侧，是您经常做运动的人，您的记忆力就会变得更好；而在最左侧，通常不怎么做运动的人，记忆力就会越来越差。
And it might be important to have somebody help you design your exercise program. So if you're not a big exerciser, at the spa, once they evaluate you, they can come up with a very specific program for your needs.
对于一些平时不喜欢运动的人，我们提供像我刚刚提的运动心电图检测，还有呼吸检测，可以帮您定制一个最适合您、最安全的运动。
So again, exercise is very good for your memory, but it's interesting in women who do too much exercise, that run marathons and too strenuous exercise,